Hello everyone and welcome back, where here we talk about everything that is health, mind, body, and soul. If you're a subscriber, thank you for joining me again. If you're new to this channel, please like, subscribe, and share this video so that we can build our family and our community of people caring for our health. In today's video, I should say this is a two-part video. So right now we're going to talk about some medical terms that might help make things a little easier for you. It might help give things a little bit more sense to you where medicine is concerned. And in the second part of the video, we're going to do a quick recap and then work on what we're going to move on into the next segment. So let's get started. Syndrome. A syndrome is a set of symptoms occurring together and characterizing a specific disease. However, a disease is a particular and distinctive process in the body with a specific cause and characteristic symptom. A disorder is a condition characterized by a lack of normal function of physical or mental processes. When you hear talk about diagnosis, a diagnosis is the process of identifying a disease, condition, or injury, its signs and symptoms based on health history, physical exam, blood tests, biopsies, etc. There's a thing called a differential diagnosis. And that's, in most cases, what a lot of people get before they get their actual diagnosis. And a differential diagnosis is a list of possible conditions or diseases that could be causing the symptoms. And that goes based on your symptoms, medical history, basic labs, and physical exam. Most medical terminology, not all, when you think of diseases and names of diseases, conditions, and syndromes, have three components to it, three basic parts. There is the root, which is usually the word in the middle, and it's the central meaning of the word. There's the prefix, which is at the beginning, and it identifies part of the root word. And then there is the suffix, which is at the end, that modifies the root word. So there's the main word, which is the root word. There's the prefix, which is going to identify the root word, and then there's the suffix, which is going to modify the root word. Here's an example. Let's take the word hypothermia. The root word is thermometer, meaning measuring heat. The prefix, hypo, which means less, lower. Or you could use the word, let's use myocarditis. Card, the root word, cardiology, heart. Myo, prefix, outer layer. And the itis refers to inflammation. I give you this so that you know, sometimes doctors are really good at explaining what a certain thing is, and sometimes not. If you can understand the root, then it'll kind of give you the rest of the word, like cardiomyopathy, okay, or myocarditis, like I just said. So remember that. Now, we're gonna have a nice, interesting winter, and I want to give you some common fall ailments outside of the obvious that we're dealing with this year. The common cold. There are over 2,000 viruses that can cause the common cold, although the most popular one is called the rhinovirus. And that's most popular because it thrives in cold weather. Sore throats are common this time of year. They usually come from a cold, flu, or bacteria. They can also happen as a result of allergies. Sleeping with your mouth open in the cold weather can do it. Strep throat, that's an example of a bacterial cause of a sore throat. It's caused by a bacteria infection. It does not go away. It has to be treated. If you do not treat strep throat, it can lead to kidney inflammation, even rheumatic fever. Pneumonia. There's different types of pneumonia. But pneumonia is basically inflammation of the lungs. It can be caused by airborne viruses. It can be caused by bacteria. Pneumonia is extremely dangerous because it can go undetected as it mimics cold symptoms, flu symptoms. So you want to be really careful with that. Just start feeling a little heavy, get it checked out. Asthma, an increase of people who have asthma, the symptoms can increase this time of year because cold air irritates the airways, and that causes the wheezing, shortness of breath that they experience when they're having asthma attack. Norovirus. Norovirus is an extremely contagious stomach disorder that causes nausea, vomiting, and diarrhea. Heart attacks are also common in the fall, and the thing with heart attacks is your blood pressure naturally rises with exertion. But in cold weather, the blood vessels are already constricted. So if you've got heart problems and you're exercising or doing strenuous things in the cold weather, you're at greater risk of having a heart attack. Bronchitis is also common in the fall. Bronchitis is an inflammation of the bronchi. Now the bronchi is the main passageway into your lungs. And the bronchitis is basically an extreme production of mucus in the lungs, making it hard to breathe, etc. Sinus infections are also common. People who suffer from underlying diseases or from colds and seasonal allergies are prime candidates for sinus infections. And what happens in a sinus infection is the fluid builds up and allows bacteria to grow, and they become infected. Whooping cough is also a common one. It's a serious respiratory disease that can be deadly, especially in infants. And it's basically a persistent cough that lasts like almost 10 weeks. Pink eye or conjunctivitis. That's really common in the winter months, and it's most contagious when it's caused by a virus or bacteria, and it is like red, itchy, watery eyes with crusting lids. And so you want to be careful for those things. We have so many things to be careful of. I'm going to take this time in my video to tell you again, eat right. Be careful what you're putting into your body. Be careful of the environment that you have close to you. Move around, exercise, get natural light. Take care of yourself. The best way to avoid most of these things, if not all, that I talk to you about is simply taking care of yourself in the best way that you know how. That's all for this video. I'll see you again in a few minutes and for the next video for part 2. Again, like, subscribe, share this video. If you want to reach me, if you have a comment, if you have something you want me to talk about, if there was something interesting that you heard in one of my videos, share it in the comment box. You can also reach me on email, which will be in my description. You can also reach me on Instagram, also in my description. That's all for now, family. I'll see you in a minute. Thanks.